GLP-1 agonists, a complete professional briefing. Why, how, what, where, when, which. Why GLP-1 agonists matter. GLP-1 is a gut-derived incretin hormone secreted by intestinal L cells after meals. It plays a crucial role in metabolic regulation by enhancing glucose-dependent insulin secretion, suppressing glucagon when glucose is elevated, slowing gastric emptying, signaling satiety to the brain. However, native GLP-1 has a very short half-life, approximately 2 minutes, due to rapid degradation by DPP-4. GLP-1 agonists were developed to overcome this limitation, providing a sustained physiological effect that improves metabolic outcomes. Why they matter clinically? They target multiple organ systems simultaneously: pancreas, gut, brain, cardiovascular system, addressing core drivers of metabolic disease rather than individual symptoms. How GLP-1 agonists work? GLP-1 agonists mimic endogenous GLP-1 but with prolonged activity. Mechanistic actions: pancreas, glucose-dependent insulin secretion. Glucagon secretion when glucose is high helps prevent hypoglycemia compared to sulfonylureas. Stomach and gut slows gastric emptying, reduces postprandial glucose spikes. Brain/CNS enhances satiety, reduces appetite and reward-driven food intake. Cardiovascular system improves endothelial function, reduces inflammation. Demonstrated reduction in MACE in high-risk patients. Drug-specific therapeutic outcomes: improved glycemic control in type 2, diabetes mellitus, 2 diabetes. Significant weight reduction, reduction in cardiovascular risk, drug-dependent. Emerging benefits in NAFLD, CKD risk reduction, and potentially addiction pathways, ongoing research. What GLP-1 agonists are. GLP-1 agonists, GLP-1 receptor agonists, are medications designed to activate GLP-1 receptors in a sustained way. Examples include semaglutide, Ozempic, Wegovy, Rybelsus; liraglutide, Victoza, Saxenda; dulaglutide, Trulicity; exenatide, Byetta, Bydureon; tirzepatide, dual GIP/GLP-1; Mounjaro, Zepbound. They are usually administered subcutaneously, except for oral semaglutide. Where GLP-1 agonists act in the body, the infographic highlights 4 major sites: gut, intestines, where GLP-1 is naturally produced and where agonists help. Enhance incretin activity, slow gastric emptying pancreas, increase insulin, glucose-dependent, decrease glucagon, brain satiety signaling in hypothalamic pathways, reduced hedonic eating, cardiovascular system, reduced oxidative stress, improved endothelial response. Lower rates of adverse cardiac events, drug-specific. When GLP-1 agonists are indicated, GLP-1 agonists are typically considered for type 2, diabetes when lifestyle plus metformin are insufficient, when weight loss or hypoglycemia avoidance is a priority. For patients with established ASCVD or high cardiovascular risk, certain agents have Class 1 recommendation and guidelines. Obesity, overweight with comorbidity, BMI greater than or equal to 30, BMI greater than or equal to 27 with weight-related comorbidity, HTN, OSA, T2D, dyslipidemia. Emerging investigational uses, not standard of care yet. NAFLD, NASH, CKD risk reduction, cardiometabolic prevention in non-diabetics, addiction and compulsive eating pathways, which patients benefit most high-benefit groups, T2D patients needing weight loss, T2D with cardiovascular disease, obesity with metabolic syndrome, individuals with high cardiometabolic risk, patients requiring caution, clinical judgment required, severe gastroparesis, history of pancreatitis, certain thyroid cancers, drug label specific, frailty with risk of malnutrition. Professional summary: GLP-1 agonists represent a multifunctional metabolic therapy that targets the gut-pancreas-brain axis. They are uniquely effective because they improve glycemic control without increasing hypoglycemia risk, reduce appetite and achieve meaningful weight loss, provide cardiovascular protection, address the metabolic dysfunction at multiple levels simultaneously. They are becoming a cornerstone therapy across endocrinology, obesity medicine, cardiology, and general internal medicine.